Ready, Diane, for me to go?
All right. Yes. I would like to welcome Naima Bond back. She did a session for Better Brains for Babies a few months ago about autism spectrum disorder, and she's back now for some more information, and we're looking forward to hearing what you've got to say. Thanks for being with us.
Thank you. Good afternoon, everyone, and thank you again for making time. And I know everyone's busy schedules for this presentation. Today's focus is definitely still on the autism theme. However, we're going to focus on collaborating with families and how do we work with families when we know that either red flags or possibly for some children ASD is on the table. How do we have those kind conversations, but we're providing families with information and helping them and guide them through the process. So we'll go ahead and get started. Throughout this presentation, there are definitely chat opportunities because I like to get an idea of what people are going through or what their current work looks like. So what do you find challenging when you're trying to collaborate with families? Now, this doesn't necessarily have to be over a diagnosis or red flags, but when you're trying to work with families for a goal, what are some of the things that are challenging? If you don't mind taking a few minutes to chat some responses in the chat box, and Diane will let me know what your responses are. We'll take a few couple minutes to kind of do that. And again, what do you find challenging when you're trying to collaborate with families?
Family dynamics is our first response.
All right, that makes a lot of sense. Absolutely.
When they're in disbelief that an issue exists.
Yes.
Parents placing their convenience over the needs of the child.
Mm-hmm.
Overcoming stigma, finances or lack thereof.
Those are all good responses. Anything else, Diane?
That's all I see right now.
Okay, perfect. Thank you for responding. Yes, the family
No
dynamic.
continuity is one more.
No continuity. Okay. Family dynamics absolutely plays a huge part in this. And then you're right. Also, again, parents coming to terms with or understanding what's going on with their children when it comes to either red flags or an actual diagnosis. And just so you know, when I came to the Marcus Autism Center, I almost thought it would be a little easier because parents are actually signing up for research. Certain things have to be present for you to even qualify. But those conversations, even when they sign up, come here, you're coming to the Marcus Autism Center for Research, when we have to give a diagnosis or maybe, we are confirming some things that do exist, parents still have a hard time. So it's definitely, when it comes to children with special needs or developmental delays, there definitely is a grieving process. And depending on where you are when you are working with them, you may have to work with and work through and combat that. So again, we're spending some time really looking at the family, whether, especially if you work in early intervention, whether families or children have diagnoses or not, you still contracted to work with families. And sometimes parents do realize that there are some red flags or things that are concerning, but they're not ready for the diagnoses. So that being said, I have some video, and what we're going to do, because again, we still want to have these important conversations with families. So we want to report on what we're seeing. So, sorry, I have to move something real quick. Sorry about that. I'll go back to it. Okay. So I have a video example. And what I really want you to do, and it's a chat-in opportunity, is we're going to look at this video, and I just want you to kind of tell me and look at what you notice, and then I'll kind of talk about what we're seeing. And when we're working with families, again, when we're giving them feedback, we want to make sure that we are absolutely talking about what's going on, what is happening, and letting the parent know the wonderful things that we're seeing and also the things that we're concerned with. So we'll just start to kind of get our minds warmed up by looking at this video really quickly. And I'm getting the, okay, there we go.
I heard him say go. Okay, you can play too, baby. 1, 2.
Good job changing it.
See you later.
4, 5, 6, 7, 9, 10. Ready, set,
And that was just a short video. I love that video because he has such a nice peer model with his sister. She's very social. She always wanted to be in the intervention sessions and she always wanted to be a part of it, which actually was really helpful. This was definitely a little guy who's presenting with red flags. So this intervention session, they were really trying to work on the social connected piece. So if you heard, there was definitely an Babies Can't Wait early intervention provider working with the family, and she was kind of giving mom feedback during the interaction. So in the beginning, he likes the balls, but he really wasn't looking to mom. He really wasn't paying attention. When she started counting, that actually got him to look at mom. And that's when the interventionist said, you know, great job changing it up, to kind of let mom know that's working. When you started counting, that actually directed his eye gaze to you. It was natural, and that's what we want. So that actually put some predictability in place so that he would know. When she got to 10, I'm not sure if you know this because, again, I've seen this so many times, but he did a little point and a little gesture like, okay, now it's time for this to go over my head. And that's what we wanted to get him to do, to start to initiate, to be more involved and be more socially connected with mom. So again, while this intervention provider was working with mom, she was giving her a short, quick little feedback so that mom would kind of know what's working, what's keeping him connected, because the idea is, of course, when she leaves, that mom continue doing some of these strategies throughout the week, and then they would kind of have a meeting the next week to see how things were going. So what we're trying to get away from is that wait and see approach, which is outdated and can delay intervention and diagnoses. And then intervention for social communication deficits in ASD are most effective if they begin between 3.5 years of age. To push to get intervention started before the age of 3.5. And we are working, just so you know, because I know that some people in the field, they do get some pushback from the medical professionals, and we are working on trainings to also bring the medical professionals in on this, to let them know that we really are trying to identify red flags earlier so that we can start working with children a lot earlier as well. So again, just some statistics and understanding about when the average diagnosis happens. This is a little bit older, it's from 2015, but again, Caucasian children are 30% more likely to get an ASD diagnosis than African American children, and 50% more than Hispanic. That's huge. So again, when we're in our communities and we're working with families, we need to kind of have that in our mind. Latino children receive a diagnosis of ASD 1 to 2.5 years later than Caucasian Latino children, and it's the same in the African American population as well. So again, you know, getting the resources out, getting the information out, having the difficult conversations. Now these again, of course, are the statistics, but there's definitely reasons why. So some of the reasons why the numbers can be so different, again, I'm not going to read all of them, but less access to information about ASD. I will say in later years, these last few years, I feel like ASD information is getting more out there, that families are hearing the word. They may not always know what all the characteristics are, and they may not understand what that word spectrum means, but at least they are hearing about it. There's still quite a big stigma when it comes to ASD, and families realize, like, what does that mean? Will my child be able to have a successful life and things like that? So there definitely still is a stigma. In some communities, there is that mistrust of the healthcare system. Language issues, again, immigrant status is something that we're all facing with and hearing about lately. Dismissal concerns by some pediatricians, and again, we are working on that, because some pediatricians don't want to say or suggest that red flags are presenting before, I mean, we're talking about 2, but sometimes before 3 or 4. So they're using some critical time when we could be working with them. Differences in screening practices, and again, a lack of validation of ASD screening tools for culturally and linguistically diverse populations, which is something that I know at the Marcus Autism Center we are really trying to figure out and work through. Now, some other beliefs, again, when you're working with the community, you're working with different populations of people, again, some of these things may be a barrier to really talking about and helping families understand what's going on. Again, supernatural causes or extrinsic factors. ASD is a temporary condition. Some people really do feel like you can outgrow it. And I have heard families say that, well, now the child doesn't seem like they have autism. Well, usually what it is we practiced some skills, we gave the child some tools, so those characteristics are not as obvious, or they've learned strategies to cope better with them. So it seems like they've lost their ASD. But it's really, now I know what to do in these certain situations, so those behaviors have diminished. Giving children more space and time, or they'll grow out of it. Again, we're trying to get rid of that wait and see. People still believe that vaccines are the cause of ASD. We're finding out that it's more a genetic link, and we can get into that. And the belief that a prior event, such as a high fever or something a parent did or did not do, causes ASD. So sometimes, depending on where the family is coming from or what information they have, you may run across some of these barriers that you may have to work through and talk to families about.
Naima, we have a question from the chat. Candace wants to know, what conditions is ASD commonly confused with?
What condition is ASD commonly confused with? Sometimes, well, I wouldn't say that it's confused with, but sometimes people think it's a speech delay versus true ASD a lot of times. And truly and honestly, what the difference is in that is children who have true speech delays have other ways that they're communicating. They may be using gestures. They may be making vocalizations. They may be giving you eye contact. So if they want something, usually a child with a true speech delay is still looking at you, still pointing to you, still making gestures and things that you can kind of figure out what they want. Children with ASD, that social component is completely, most cases, not every case, null and void, where I want something, but I'm not indicating anything to you. I'm not looking towards toys. I'm not looking towards the refrigerator. I have no idea kind of what you want or what you need. And that's why sometimes autism and behavior, people automatically assume that a symptom of ASD is behavior. It's really not. But if I have no way to communicate, no way to send my messages, I'm going to get angry. So depending on how little I am able to at least direct my communication, these behaviors start to develop. You don't have to have ASD and behavior, but again, behavior is a form of communication. So if I, in my mind, know what I want, but I can't show you what I want, I'm getting angry and frustrated, and so these things happen. So a lot of times people will think because there's no words that it's truly a communication delay. But what you're looking at is, what's the social piece? Is a child still, when they enjoy something or they're excited about something, are they still showing it? Even if they don't have the words, are they pointing? Are they using gestures? That's kind of the difference. And a lot of time families do think it's a communication delay when it's true red flags for autism. And again, the difference is with autism is that social piece. You don't realize how important social skills are until you come across a child who doesn't have any. We really are a social society. And so you're not looking or showing or pointing and looking at me to send direct messages, that's a truer indication. I hope I answered that. So again, this is kind of, when you're working with families, this is kind of our wheel that we kind of look at. And again, all of these things play a factor in, when I hear this information, how I'm going to internalize it and how I'm going to feel about what's going on. So again, when you're working with families, even though, especially us as professionals, we're like, it's so obvious, let's get going, let's get intervention started, we have to realize that this is not necessarily the parent's background, the caregiver's background, and all of these factors, depending on where they fall, may present as a barrier to getting the child services. So how do we work around that? How do we work to help them understand what we're here to do and how we're going to support them? So again, when it comes to sharing information, understand that they also have concerns. And again, they may not be able to say red flags, or they may not be able to say autism. But if they contacted Babies Can't Wait, a referral from somewhere came in, or if they're signing on for early intervention services, something's going on. So, understanding that they also have concerns. Acknowledging that they need a great deal of information sharing to understand what is happening with their child. And again, depending on where they're getting their information from, you may have to dispel some information that's just not correct. I had a family who was convinced, this was years ago, but something that they were eating, like she ate a lot of chili peppers when she was pregnant, and she really thought that did something. So, there was a lot of guilt. She was very guilty. So, really giving families that information and, giving them the true information, evidence-based research information. And then fear of the unknown, fear of the word autism. What does that word mean? When you think of your child's education and as they grow up, what does that mean? And usually what I would say to families is, now that we kind of have an idea if it's red flags or we actually know that it's autism, now I can actually give you strategies and supports so we can teach your child how to operate effectively in routines, get to and from places, how to ride in a car. Now that we know what it is, we can actually give you those tools. So it's that kind of reassurance and helping them understand. And that they want the best outcome for their children. And, really listening to and meeting them halfway is going to help with those conversations. So one way when we're talking about...
We have one more question, Naima. Sorry to interrupt. Karina asks, there was a 2-year-old in my toddler class that was given a provisional diagnosis that was later rescinded. Is this common?
It can be. So I know at the Marcus Autism Center, depending on the age, we will give provisional diagnoses. So how that works is at the time they do the ADOS, which is very specific to children with ASD, and certain characteristics and things will come up in that evaluation. They can come back a year later after the child either has had intervention or maybe worked on some skills. And if they don't see the same characteristics, it can be rescinded, depending on the age and what was present in the beginning. Yes, that does happen. I'll be honest, it doesn't happen often, but it does happen. And sometimes we will give young kiddos the provisional so that they can start the early intervention services and get some of those services with the provisional. And then they can come, I can't remember if it's up to 1 year or 2, but I know that from the time they receive the provisional, they can come back the following year and get retested again and kind of see where the child is at. Good question. Okay, I'm back. So one technique that we use to kind of get consensus with families, and when you're collaborating with families, when you're working with them, you do want to try to get some kind of foundation and consensus, because again, if you're working on certain strategies, you want to make sure that we both understand what we're doing and that we're working together and we're on the same page. So one way to do that is using motivational interviewing. You kind of look that up, but it's not directing and telling families this is what you need to do. And it's not completely following families because certain skills have to happen, but it's really kind of doing a little mix of both, and there's some overlap. So you kind of talk about the family, about goals. And I know that can be hard sometimes because sometimes parents want certain things or they always want words. But if, again, I'm not following language, I'm not listening to simple directions, you can't expect me to have words. So it's kind of a way to acknowledge what the parents want, but kind of show them the steps that it will take to get there. And so when you, excuse me, do that by guiding and facilitating the conversation and kind of giving them information to help them understand that these are the steps we have to go through first before we can get to that big goal that you want for your child. So how do you guide the process when you're talking to caregivers about strengths and areas of concern? When you are working with children or when you are working with the caregivers and you do have to kind of talk about what you're seeing, how do you start those conversations with families? If you would take a moment to chat that in, please.
We're starting to get some responses, Naima. The first one is
Okay.
ask open-ended questions,
Perfect.
build rapport, and begin asking them questions.
Mm-hmm.
Just waiting for a few others.
Yeah,
Sandwich, good.
Yeah.
Facts, concerns, good.
I learned that when I was a pre-K teacher.
Lead
Yes.
with strengths. Ask them what their concerns are. Say again, always start with the strengths, address concerns, and then return to strengths.
Mm-hmm. Absolutely. Absolutely. And asking the parents what their concerns are is a great way to open it up. Sometimes parents are very verbal. I know sometimes parents might say, oh, I don't really have concerns. So that can be a little more challenging. But giving them the opportunity to share and then you kind of say, oh, I can see, or yes, I have seen that, or oh, okay. I was thinking along those same lines. So it's a nice way also to have consensus about what everybody's seeing so that we're all on the same page. Thank you.
Ask their concerns, show empathy, ask what are the strengths, and maybe observe.
Mm-hmm. Mm-hmm.
Be
Absolutely.
sensitive to the child's condition.
Yes. We have to remember that this is our field of expertise. We probably said these types of things all day long. For the parent, it's their first time. So we want to be very sensitive to that. Absolutely.
One more good one, repeating back what they say to make sure you understand what they're saying.
Oh, that is a great skill, because I know that I've done that, because before I was at Marcus, I was a disabilities coordinator with Head Start. And especially in the meetings where you have concerns about challenging behavior or developmental delays, I would ask them to repeat back, or I would repeat back to make sure everything was clear. Because sometimes they would hear things that I did not say. And I always wanted to be sure that I heard what they were saying so there would be no misunderstanding. Thank you. And again, I have pretty much what you all said. Communicate child strengths first. Again, being that good listener. Describe the behavior rather than using labels or diagnoses, exactly what you're seeing. Allow families time to think, process, and respond. And again, share information and resources with families. Absolutely. Then again, after the conversation, you may want to check in with the parent to make sure the information was understood and received. You know, what did you see? Is this consistent with what you were seeing? That's a great one. Is this consistent with what you were seeing? Again, making sure that what I'm reporting on, what I'm discussing with you, you're at least familiar with it. Does that make sense? And then we can look at the social communication milestones as a reference. I actually, Diane will send you, I didn't even think about it. I was going to send you some of the social communication milestones. I can send those to you so that you can send out to everybody, just so they can see what some of those are for language.
Yes, I'll make sure that we send those out.
Okay. I will definitely do that after this. And again, just being, someone mentioned open-ended questions, but again, you want to make sure that you're asking permission. Again, do you mind if we talk a bit about your child? Just being as respectful as possible. You know, this is kind of like that initial conversation. I know your child's pediatrician has referred you. The babies can't wait. Do you mind if we talk about what you see are as concerns for your child? And again, I was using babies can't wait as an example, but it may be any early intervention or anything where you're talking to the parent. And again, those open-ended questions, you know, what brought you here today? What was that like for you and your child? What happens when your child communicates, behaves that way? And that's always a good way too. Asking the parent, you know, how does your child communicate when they're hungry? How does your child communicate when they want to go outside if something isn't pleasant? You kind of want to get an idea of what are they seeing? You know, are they always screaming? Are they always crying? Do they sometimes maybe do a slight gesture or something that you can build off of? Getting as much information from the parent as possible. Now, this is actually a parent who's just kind of discussing kind of what's going on with her child. So I'm trying to move something out the way. And if you would just kind of chat in what you're hearing. Oh, I went too far. What you're hearing the mom say.
Go ahead.
She's trying to communicate a lot more, so she is starting to get frustrated if we do not understand what she is trying to communicate to us.
Okay, how is she trying to communicate more?
She will look at us in the face,
Mm-hmm.
and she babbles a lot now, and she will look at you, and she will babble and look you right in the eyeballs, and you can tell she's trying to tell you something.
Okay.
And you're like, yeah. So I just play along because, like any mother would do, you know.
Uh-huh.
Oh yeah, you know. And then she'll kind of look at me a little weird, and then babble the same thing she just babbled. And then when I don't get it, she either, that's a good job, thank you. She either cries or she'll try to lead me to what she's talking about and put my hand on it. But first, it's like, and my husband, I've noticed that now when she babbles, she will look us straight in the eye and babble.
Okay.
And then if we don't get it, then she'll.
Those times when she's babbling about it and then she takes your hand and she takes you to it.
We always say, oh, you wanted.
Does it then become apparent what she was trying to say, or you're just kind of putting pieces together to get it?
Kind of putting pieces together.
Okay.
All right, so we heard that. So what are some of the caregivers' concerns from that? If you just chat in, I think a good job of explaining it. What are some of her concerns?
Unable to understand the child's communications, that her daughter's becoming frustrated, not being able to understand exactly what her child wants her to do, child's ability to communicate her needs and wants verbally, caregiver seems to be trying to understand her child's wants and needs.
Right.
And then we have a question, what are your thoughts about the parent talking about the child in front of the child?
You know, that's a good question. That's a really good question. Because of the intervention, and that actually was one of those things where she asked and she just turned the camera on. Usually I would say, you know, maybe have her be in the other room, but that was actually what happened after that is they actually practice with some of the strategies that we teach them here at Marcus, you know, to kind of have an idea of where to go next. So that information at that point was kind of critical to kind of understand in the session where they were going to kind of go next in the session. So normally I would say it just was a little bit longer than they thought it would be. That's why it was like a really kind of a good sample. But because it was during the session and it was kind of dictating the next steps in the intervention, it was kind of necessary. That was a good question though. Yes, usually if you are debriefing or having an in-depth conversation with the child, we still, even when they're young, suggest that they go in another room. This just happened to be in the middle of the session, so it was literally dictating the steps to finish the intervention. So we kind of allowed it to happen, but that's a great question.
And the follow-up comment from Lauren is, thanks. When I talk with parents, I try to either not talk in front of the child or at least add in some positive attributes so the child hears some positives along with the challenges being shared.
Yes, absolutely. And, you know, again, normally, absolutely, we do, you know, we debrief, the child is like in the other room or something like that. This just happened to be right in the middle of the session. And so it was great dialogue because mom really shared, but it literally dictated what they were doing like the last 15 to 20 minutes of the session. But that's a great question. And you're right, usually we would definitely separate. Luckily, I kind of know because I was part of this, so I kind of knew what was going on. But yes, absolutely. Anything else, Diane?
Couple of other comments as far as concerns the child is knowing something's not normal, the child's unresponsiveness. Tyra says she's excited about the progress the child's making and wants the interviewer to know that she's doing much better than before.
Oh, yay. Okay, great. Great. All right. So again, with that reflective listening it sounds like what I hear you saying. So on the other hand, it sounds like, and yeah, well, that one's a little confusing. I haven't looked at this in a while. It seems as if I get the sense that it feels as though, and you guys, you send the slides out, right, Diane? Do you send the slides?
Yes. Sorry,
Okay.
I had myself muted. Yes.
No, that's okay, because I will send you the after this, the one with no video, so you guys can have these. But these, especially if you're newer at this, these prompts sometimes can be very helpful just to kind of reference to make sure that the conversation is flowing and that you're getting as much information from the caregiver as possible. Now, in this one, we kind of want to look at what's going on with our same little friend here, and this time chat in strengths and areas of concern. So what do you see as a strength here with the little one, and then what do you still see as a place that we need to work on with her?
Snake, S for snake. Looky here, you want to do U for umbrella or N for nuts? Nuts. N. Looky here, you want to do
No, look at mommy's letters.
E, that's right. Looky here. You want to do K for koala or U for umbrella? There's U.
Umbrella, that's right.
That's right. Here, that's umbrella. You want to do P for piano? Yeah, P for piano. What about G for globe? Yeah, I'm on the letter. I'm gonna give them to you. Put the G up. That's A, B, B, C, D, E, F, G. That's O, P, Q, R, S, T, U, V, W, W for waffle, X.
All right, so from that interaction, what do you see as a strength, an area of concern? If you would just chat those in real quick.
Strengths. The child's a self-starter and has persistence. The child is using other means of communication.
Mm-hmm.
Being able to be independent and do it herself, taking the initiative to try communicating better, pointing.
Mm-hmm. And what are some areas of concern?
Eye contact is an area of concern.
Mm-hmm. Mm-hmm.
Language, not following instructions,
Okay.
not paying attention with the parent having to be redirected. Another strength, she allows her mother to participate in the play routine.
Yes, I will say this was major, the fact that her mom was able to hold the puzzle pieces. It took a long time for mom to kind of get there. But within that, so again, areas of strength, again, this is definitely a routine that she's familiar with. She kind of knows how to play it, which is helpful because she knows what the outcome will be. So that's helpful. That kind of keeps her in the space and keeps her emotionally regulated. An area of concern is definitely, it's starting to become a more social activity, but it's not quite there yet. What you may or may not have noticed was when mom didn't say the letters, she would look up to mom to like cue her to say like, okay, I'm ready for the next letter. So like a next step for her would be, when she's doing this is maybe do A, B, C and pause and see if her daughter will look up to kind of start establishing that eye contact, because again, this is very motivating for her. She likes the letters, so she can kind of use that by pausing every few letters to get her daughter to reference up, because when she wouldn't say it immediately, she definitely did reference up. And mom was holding the pieces and kind of giving her a choice. But I would even wait a step further, because I can't remember, she knew the alphabets, but she was more motivated to say those letters, to kind of even wait to see how would she indicate for mom that she wants a letter. You know, would she point? Would she try to vocalize? Would she look at mom, kind of seeing how she would direct her communication? Okay. So, and you guys will get this, again, understanding and recognizing the red flags in toddlers for ASD. And some of these we kind of know. Again, the eye gaze and limited speech are kind of ones that we pretty much all pick up on. The odd sounds or unusual tones, sometimes we don't always think about. Limited or no pretending or imitating people, of course. Stop using words they once had. The other red flag is when children had skills and then they start losing them. And using another person's hand as tool, that's literally when they take you and they're not looking at you, but they'll drag you somewhere, or they'll push your body into the area that they want. A lot of parents think, oh, well, they are communicating, and they are. But again, if they're not looking directly at you and they're just pulling you along, it's, you know, they know they need your hand to open something or to get something, but they're not connecting that, oh, I can actually send this message to you because you're my caregiver and you'll get it for me. So that's something that sometimes people get. It is definitely a form of communication, but that is a red flag for ASD.
We have another question.
Okay.
How do you strengthen the social communication? Are you going to address that later, or?
Well, okay, so I gave a couple examples of that with the puzzle. Again, if you may or may not have noticed with that video, when mom didn't initially say the alphabets right away, she actually looked up at mom naturally without being prompted, because she wanted mom to say the word. So the use of pausing when it's a activity that is very motivating and the child really, really likes, that's one of our strategies, is to kind of pause, especially when it's a routine that is predictable. Because before, obviously, mom probably went through the alphabet all the time. So when she stopped, she knew something was wrong. So she's looked at her like, hey, I want you to say the letters. Like I said, holding the pieces back and having her have to look at, point, indicate to mom that, okay, I want another letter, I want another piece, is one way to, any way that you can get the child to naturally send you a message. Even if it's looking and making a vocalization, you have to kind of figure out the way to motivate the child to interact with you, because you have something they need to get that activity to go. Hope that makes sense. If it doesn't make sense, if I answered your question, please chat that into Diane so I know. I mean, those are a couple things that you can do to kind of help. Because what that is that puzzle she does a lot by herself, and you were introducing mom as the social partner in that. So she had to kind of figure out how to work with mom to get the activity to go. I hope I answered that for you.
Yes, you did.
Okay, perfect. ASD and toddlers, again, with that social interaction. The biggest thing from this list that I truly did not really understand until I came to the Marcus Autism Center was, does not share warm, joyful expressions. Does not draw your attention to things or show you things that you're interested in. That is a big one with the social interaction. When they're living, like, oh, what's that? Ooh, that definitely is a red flag. Just, am I sharing? Am I showing? If I'm doing something cool, am I looking to you like, oh my gosh, do you see what I just did? So that shared enjoyment, like, this is so cool, I want you to see it too. That's the big one with social interactions. And of course, not looking. The other one is not responding to their name. At 6 months old, children understand and recognize their name. Now, I know some children will ignore you, but for the most part, if you're calling and they're not referencing, they're not looking, they're not paying attention to their name, that definitely is a red flag as well. And these, we kind of know the repetitive behaviors and restricted interests. Again, unusual ways of moving your hand and finger. And when we did the red flags webinar, if you're a part of that, we kind of really went through what some of those repetitive behaviors and restricted interests look like. Again, excessive interest in particular objects, actions, or activities. You know, the children who are really into trains. So, you know, the other thing with autism, and this happens with slightly older children, but children who they have language, but it's restricted. So if I'm going to be talking to you, I'm only going to be talking to you about trains or cars because that's what I'm interested in. I'm not having a real conversation. That sometimes throws parents because they obviously hear the language, but it's not functional because it's not attached to, you know, if it's raining outside or anything like that, or what we're doing in the house. It's really restricted. Yes, it's great because that means you have language and words, but we have to get you to kind of come out of that restrictive area and kind of talk about and make your language more functional.
We've got a couple more questions, Naima.
Sure.
One question is, what are red flags in preteens and teens? The other question is, how do you decipher the difference between red flags and it maybe just being the child's personality?
Right, that's a good question because there definitely are still children who are loners. You know, it would definitely have to be a lot of these symptoms. You know, if a child's just not looking at you, they just may not want to look at you. But if they're not sending messages, they're not directing their communication to you. When they're upset, they're just upset and they can't articulate to you. It's like a combination of things. In preteens and teens, that's I'm sorry, it's Naima's personal stuff. This is not scientific, but teens and preteens are just hard. You would have to look at, you know, school history, friend history. Is it easy or hard for them to make friends? Does it seem like children like them or not? There's so many factors. If you truly are concerned, it's definitely a conversation with your, you know, pediatrician or your family doctor to really look at the signs. Again, I will definitely send these slides over so you can kind of look at what the red flags are. And these red flags are pretty universal. So, but it definitely can't be one or two. It has to be kind of majority of the symptoms. That's why, again, when sometimes parents think just because the child's not talking, it's a speech delay. Well, there has to be a lot of other factors to rule out just speech. Again, if there's no social context, there's more red flags for autism. So you just really have to look at everything and look at the whole picture, not individual days, because some days are going to be where some teens are not going to want to talk to anybody. So you just have to really look at the whole picture. But if you really are concerned, definitely check in with your family physician or pediatrician and draw those concerns to them. And then they can absolutely direct you if an evaluation or something needs to happen, they can absolutely direct you in that direction. Let's see. I'm trying to think as far as repetitive behaviors, restricted interests. And sometimes we don't think of under arousal, that child who kind of, you know, we tend to say is spaced out or checked out. And, you know, you're still not engaged. You might be quiet, but you're not participating. You're not engaged in things. That's also a red flag as well. Now, this was in talking about developing IFSP goals, but it could be any goals that, you know, if you're working with a family on intervention, again, gathering more information from the caregiver, asking the caregiver, what are your goals for your child? Because again, as clinicians, we may have very specific ideas on what we think the child should do. But the other side of that is, what is the caregiver really going to practice with the child? We have to kind of take our professional, you know, clinical goals and match them to the families. Because again, if we want certain change to happen, they have to be on board. And again, that's where that collaboration piece comes in. And then also helping them understand where the child's current functioning level is. That can be challenging. Because again, if a parent wants words, but this child is sending no messages, you know, is only making a few vocalizations, it's going to take a little while to get there. Again, sharing in information, filling in the blanks, and then collaborating goal planning. So let me see where we are here. Okay, this is really, really helpful. This was developed by a speech and language pathologist here at the Marcus Autism Center, and this is development of intentional communication. And we're very specific with that, intentional communication. So again, it starts with smiles, laughs while you're looking at me. Uses voice to seek and maintain attention. And it kind of goes up, and if you see at the very top, first words and simple phrases at the very top, but there's like 1, 2, 3, 4, 5, 6, like 7 steps before you even get to the words. So when you're talking to families, you know, and they say words, say, great, I agree. We really do want to get words. But before that can happen, we've got to get your little one to shift eye gaze between people and objects, because that's the beginning of joint attention. So we have to give your child a reason to use words, and they have to know that we're working on something together. So that's where we're going to start, with the goal that once that piece and some other pieces work together, we're going to get to the words. So it kind of helps families see what all really has to happen before we can expect words to come on board. There are many, many skills that we take for granted, but these are the skills that we need to kind of work through to get to those words. So this is very helpful to also just give a visual for caregivers to understand where they are and what we need to do to get to where they want to go. Now, this we've included as, again, providing feedback if you need a template. Sometimes people don't need templates, but this is one that you can use. I mean, it says in today's evaluation, but you can substitute that with, you know, session, and kind of giving you some verbiage as to, you know, I noticed some things, including, and those are the strengths. Are you noticing these behaviors at home? There were also some areas of concern that I would like to discuss with you. And now it says these are also red flags for autism, ASD. Now, for some families, that may be too much. You may want to leave that line out. But you do want to talk about the areas of concern, or at least what your next steps are going to be. And then, of course, again, talking about, are you noticing these behaviors at home? So it is a little template that can be helpful. We kind of went over that one. This I will also send you, but this is also a red flags for ASD in toddlers. It's kind of a checklist. So if you need some documentation or you need some information to kind of help parents or caregivers understand what's going on and why you feel like these are red flags. Again, it says red flags. It's not a diagnosis, but these are the things that present as red flags. It's something that you can share with them so that they can kind of see why you feel the way you feel. Now here's a last case study, and again, when you work with families in the homes, you may see some of these scenarios. So we're just getting practice kind of observing and kind of saying what we see. I want you to try to identify strengths and then areas of concern in this video.
That's kind of perfect. What does the horse say? Nay. Rabbit. Rabbit doesn't quite make a noise except for. Oh, we don't want to watch it?
It looks like a fire truck, doesn't it?
A fire truck, but it's a tractor.
Red tractor.
What else do we have? Rabbit, I know. Chicken. Rooster. Pickle.
Now we got a turkey. Yeah. It goes point, 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 point. Oink.
Oink.
Oink, oink, oink.
Good job. I'm glad you said that.
Oink, oink.
Oink. Okay. Turkey. But turkey. Good Good job. Gobble, 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 gobble.
Turkey. Turkey and pig. Like piggies. Oh.
All right, I'm gonna stop it there, and I just want to know what you guys seeing as far as areas of strength and areas of concern.
Strength, persistence.
Mm-hmm.
A couple of concerns, not interested or responsive to closeness, very little eye contact with adults, tunnel vision, single focus, did not acknowledge someone going out the door. He liked making sounds. He seemed to be engaged with the animal sounds after knowing which animal it was. I liked how the parents were excited and made the sounds too. Praise is a strength.
Good. Now, when I've shown this video before, a lot of caregivers were upset that he was on the table, but you know what? That's his mommy and daddy. If that's how they do puzzles, again, that's with that collaboration where you have to let things go in the beginning. Because of that, he was a flight risk at one time. So the fact that he was kind of sitting like that was a good sign, because he wouldn't stay very long. Eventually they got him to be in a chair, but again, that's when you're working with families, kind of meeting them where they are and trying to work on some things. And he was imitating some of the vocalizations. He did like the animal sounds. I love this because Dad always worked his schedule so he could be a part of the intervention, so that he would know what was going on, which is amazing. Definitely some things to work on, but the family had a lot of strength. They definitely were a very strong unit, and in the end, that really was able to support him in his intervention. So again, as professionals, we evaluate what we see. We explain this information to parents and make suggestions. Just a reminder, we do not diagnose, and we always say, parents, if they want to know, it's definitely red flags. And, that needs to be confirmed by professionals other than myself if there is a true diagnosis. If families have questions about diagnosis for their children, we refer to the primary physicians or developmental pediatricians or other professionals that can make a diagnosis. And we can still provide service and support to that child's needs regardless of an official diagnosis as well. It's a process. Sometimes families need more time. And again, with or without a diagnosis, we can still get the child working on some important skills and teach some supportive strategies. And we just really have to work with the families and meet them where they are. This is also from the CDC, tips for talking with parents. If you still need additional resources or understanding, how to have those difficult conversations, that's available to you as well on their website. And I don't know if anyone else has any questions. We have a little bit of time. So if someone has questions that they want to ask.
Anybody else have additional questions for Naima on communicating with families?
Or any comments even. There may not be.
Thank you.
No, that's nice. Thank you.
A great job.
Oh, well, thank you.
Mm-hmm.
And at this time, if you don't have questions, definitely I will be sending the slide set to Diane along with some of those additional handouts today. So you definitely can get them. But if you don't have questions, you absolutely have permission to log off and finish out your day. I just